Let me ask you something. When was the last time your doctor told you to get just one more test, even though you felt perfectly fine? For most people over 70, those routine medical tests have become part of life. Blood work, scans, heart exams, colon screenings. But what if I told you that some of these so-called routine checkups might actually be doing more harm than good? I know that sounds shocking, especially when it comes from a doctor. But stay with me, because by the end of this video, you'll understand why blindly repeating certain tests could be one of the biggest mistakes seniors make with their health. You see, medicine evolves, but the system doesn't always catch up. Many of the tests designed decades ago were based on younger patients or on medical guidelines that no longer apply to people in their 70s or 80s, and yet they continue to be recommended automatically, as if your body at 75 were the same as it was at 40. That's not just outdated, it's dangerous. Let me give you an example. Last year, I met George, a retired teacher, 74 years old. His doctor suggested a routine imaging test, just to be safe. George trusted him, of course he did, and took the test. But the result showed something suspicious. What followed was a spiral of stress, more scans, a biopsy, and finally, surgery that left him weak for months. Later, it turned out that the abnormality they found was harmless, a small age-related change that never needed treatment. George lost his energy, his appetite, and almost his independence, all because of a test he didn't really need. Now, I'm not saying all tests are bad, far from it, but after 70, your focus should shift from detecting everything that might be wrong to protecting what's still working beautifully inside you. And that's exactly what we'll uncover together today. The 5 medical tests that every senior should rethink, and the smarter, safer alternatives that keep you healthy without unnecessary stress or risk. Because your golden years aren't about fear, they're about freedom. And knowledge is what sets you free. The first test you may want to reconsider after 70 is the annual full-body scan, the one many doctors suggest just to make sure everything's fine. Sounds reassuring, doesn't it? But here's the hidden truth. These scans can often cause more anxiety than clarity. Let me explain. A CT or MRI is incredibly detailed, and that's not always a good thing, because as we age, our bodies naturally change. Small spots, cysts, or shadows appear, most of them completely harmless. But to a computer screen, they look suspicious. And once that image appears in your medical file, the chain reaction begins. More tests, more biopsies, and sometimes even unnecessary surgeries. I'll never forget Maria, a 78-year-old grandmother from California. She was healthy, active, and went for a full-body scan after a friend told her it might catch something early. The scan found a mass on her kidney. Her doctor looked worried. She was terrified. After weeks of testing and sleepless nights, the final result came back. It was a benign calcium deposit, perfectly normal for her age. But the emotional toll, the stress, the fear of dying, it took months to fade. That's why many specialists, including the U.S. Preventive Services Task Force, now warn that routine whole-body scans for healthy seniors are not recommended. The radiation, false alarms, and unnecessary procedures often outweigh any possible benefit. So, what's the better alternative? Instead of chasing problems that don't exist, focus on symptom-driven imaging. That means get a scan only if you have clear symptoms, pain, bleeding, weight loss, or a change in how your body feels. Your body is wise. It tells you when something's wrong. You just need to listen. Remember, prevention doesn't mean fear. It means balance, knowing when to act and when to simply live in peace. Now let's talk about one of the most common and most misunderstood tests for men over 70, the PSA test for prostate cancer. You've probably heard it said, better safe than sorry. Do your PSA every year, but here's what most men are never told. After 70, this test can cause more harm than help. You see, the PSA test doesn't detect cancer itself. It only measures a protein level in your blood, and that number can go up for many harmless reasons: aging, inflammation, even a recent bike ride or intimacy. Yet the moment your PSA comes back elevated, everything changes. Doctors start talking about biopsies, possible cancer, and suddenly fear takes over. I remember Mr. Lawson, a kind, gentle 76-year-old man who came to my office trembling. He'd had a slightly high PSA on his routine checkup. His doctor rushed him into a biopsy, and within a week, he was facing surgery. But here's the heartbreaking part. The cancer they found was so slow growing that it never would have affected his life. He could have lived happily for decades without ever knowing about it. Instead, the surgery left him incontinent and depressed, feeling less like himself, all because of a test that wasn't even necessary. Now, this isn't just my opinion. According to the American Urological Association, for men over 70, routine PSA screening is no longer recommended unless there are specific symptoms or family history. That's because most prostate cancers in older men grow so slowly that they never cause harm, but the treatments often do. So what should you do instead? If you have urinary problems, pain, difficulty, or blood in your urine, then yes, talk to your doctor. But if you feel fine, forcing a test out of fear may only lead to stress, side effects, and regret. At your age, peace of mind is priceless, and sometimes true strength lies not in doing more tests, but in trusting your body's wisdom and focusing on quality of life. Now, let's talk about a test that almost every senior has been told is essential: the colonoscopy. For decades, this test has been the gold standard for catching colon cancer early. And yes, for many people, it's a life-saving procedure. But here's the truth most doctors rarely mention. After 75, a routine colonoscopy can sometimes bring more danger than protection. Let me explain why. As we age, our digestive tract becomes more delicate, sedation becomes riskier, recovery takes longer, and the bowel preparation, that exhausting 24-hour process of fasting and cleansing, can cause dehydration, dizziness, and even fainting in older adults. Then, there's the risk during the test itself. Small tears in the intestinal wall, internal bleeding. These are rare in younger patients, but much more common after 75. I remember Eleanor, a 79-year-old widow who loved gardening and baking for her grandkids. She felt healthy, but her doctor insisted she repeat her colonoscopy just to be safe. 2 days later, she was in the emergency room with internal bleeding. The result? No cancer, no polyps, just pain, weakness, and months of lost energy for a test she didn't really need. And she wasn't alone. A large National Institute on Aging study found that the risks of routine colonoscopies beyond age 75 often outweigh the potential benefits, especially when prior tests were normal. So, what's the safer approach? Doctors now recommend something called selective screening. That means if your last colonoscopy was clear and you have no new symptoms, no bleeding, no pain, no changes in bowel habits, you can safely stop doing them. For most seniors, that's a huge relief. You've done your part. You've earned the right to live your later years without constant medical procedures. Sometimes the bravest decision isn't doing more, it's knowing when to stop. Now let's shift focus to women over 75. Many are told you must continue yearly mammograms. It sounds harmless, even responsible. But the reality is more complicated than the pamphlets and waiting room posters suggest. Let me tell you about Margaret, a 77-year-old retired teacher. She loved reading, painting, and hosting her grandkids. Her doctor recommended a routine mammogram. Weeks later, a biopsy was scheduled just because of a tiny shadow on the image. Margaret was terrified. The biopsy caused infection. She needed antibiotics. She spent days in pain, lost sleep, and had anxiety she'd never experienced before. And here's the kicker. The cancer was non-threatening, something her body could have lived with peacefully for years. Studies in JAMA Internal Medicine confirm this. For women over 75 with no symptoms and a history of normal mammograms, the likelihood of finding life-threatening breast cancer is extremely low. Meanwhile, the risk of overdiagnosis, false positives, and unnecessary treatments skyrockets. Here's what you need to know. Routine mammograms after 75 are not automatically life-saving. Treatments resulting from small findings can reduce quality of life. Surgeries, radiation, and chemo in your 70s or 80s are not trivial. Decisions should be personalized, not protocol-driven. The right questions to ask your doctor. Given my overall health and life expectancy, is this test truly necessary? If something is found, what would treatment involve? And what are the risks? Are there non-invasive alternatives or watchful waiting strategies? Margaret chose active surveillance instead of immediate treatment. 5 years later, she's painting, reading, and enjoying her family, without surgery, without trauma. The lesson is clear. More testing isn't always better. Sometimes, less is more, especially when it protects your independence, energy, and peace of mind. Now let's talk about diabetes testing and tight glucose control. Something almost every senior has been told is critical. But after 70, especially if you're frail or have other health conditions, aggressive blood sugar management can actually do more harm than good. Meet George, 78, a retired engineer and avid gardener. He was healthy, walked every morning, and loved his grandchildren. His doctor pushed for strict glucose targets, HbA1c under 7.0. George tried his best to comply: strict diet, multiple medications, constant finger prick checks. Within weeks, he suffered 2 severe hypoglycemic episodes, sudden confusion, dizziness, nearly falling down the stairs. His independence and confidence were shaken. The treatment meant to protect him was putting him in real danger. Studies confirm what I saw over decades in practice. Tight glucose control in frail seniors increases risk of hypoglycemia, hospitalization, and even death. The American Diabetes Association now recommends more relaxed targets for elderly patients with limited life expectancy. For many seniors, HbA1c of 7.5 to 8.5 is safer and more realistic. Here's what to ask your doctor before agreeing to strict diabetes management. Given my age and overall health, what glucose targets are safe and realistic for me? What are the risks of hypoglycemia with tight control? Would a slightly relaxed target actually be safer and still support my long-term health? George adjusted his targets under guidance. Within months, he regained his energy, reduced stress, and avoided further dangerous episodes. He continues gardening, walking, and enjoying family meals without risking his life over aggressive. The truth is uncomfortable. More tests and stricter targets aren't always better. After 70, quality of life often matters more than numbers on a chart. Finally, let's discuss something many seniors never question: routine CT scans, PET scans, and other extensive imaging. At first glance, it sounds harmless. Let's make sure nothing's wrong. But here's the problem. These scans expose you to significant radiation and almost always reveal incidental findings, small abnormalities that may never cause problems in your lifetime. Meet Helen, 81, a retired schoolteacher with a love for travel. Her doctor ordered a full-body CT scan, just to be safe. The scan found a tiny nodule in her lung. Immediately, Helen faced a cascade of biopsies, procedures, and anxiety. The biopsy caused a pneumothorax, collapsed lung. She spent 3 nights in the hospital, hooked up to oxygen. The nodule? Completely harmless. It would never have affected her lifespan. This scenario is far from unique. A study in JAMA Internal Medicine showed 23% of elderly patients undergoing routine scans experienced complications from follow-up procedures, with zero improvement in survival. Here's the takeaway. Before agreeing to any scan, ask your doctor 3 critical questions. What specific symptom or concern makes this scan necessary? How likely is it that any finding will actually change my treatment or extend my life? What is the risk of incidental findings leading to harmful interventions? Helen chose active monitoring instead of immediate procedures. She recovered fully, avoided unnecessary surgery, and is now enjoying her grandchildren, traveling and reading without the fear that comes with overtesting. Remember, finding a small abnormality doesn't always save your life. Sometimes it just puts you at risk. After 70, every test must pass the risk-benefit test, not the let's be safe routine. Now that you know all 6 medical tests that often do more harm than good, you can make informed choices and protect your health and independence. Now that you know the truth behind these 6 common tests, you might be wondering, so, what should I do the next time my doctor orders one? The answer isn't to reject every test. It's to ask the right questions, the kind that protect your health, your peace, and your independence. I've taught these same 3 questions to every patient I've cared for in my 30 years of practice, and I want you to remember them because they can change everything. Question number 1. What will this test change? Ask your doctor. If this test comes back positive, how will it change my treatment or quality of life? If the answer is vague, or if the test wouldn't change your plan either way, then maybe it's not worth the risks, stress, or radiation. Question number 2. What are the risks of doing and not doing this test? Every test has risks, false positives, complications, unnecessary treatments. But sometimes not testing carries its own risks too. Understanding both sides of the scale helps you make a calm, informed decision, not one driven by fear. Question number 3. Do the potential benefits outweigh the harms for someone my age and health? This one is the most powerful of all. Medicine should be personalized, not one size fits all. A test that's life-saving at 50 might be pointless or harmful at 80. Your doctor's job is to help you find the balance between longevity and life quality. When I shared these 3 questions with my patients, something incredible happened. They started to feel in control again. They stopped being passive participants in their care and became active decision makers. That's what I want for you too, because true health after 70 isn't just about avoiding disease. It's about living wisely, calmly, and with dignity. So the next time you're sitting in your doctor's office and they recommend another test, take a breath, smile, and ask these 3 questions. They may just save you from unnecessary pain, stress, and confusion, and help you focus on what truly matters: a life well lived. If you've made it this far, I want to thank you, because that means you care, not just about living longer, but about living better. What we've talked about today isn't anti-medicine. It's pro-wisdom. It's about knowing when modern tests heal and when they harm. I've seen too many good people like Maria, George, Helen, and Margaret, spend their later years in hospital rooms they didn't need to be in, recovering from procedures that never had to happen. And I've also seen others who asked the right questions, who slowed down before saying yes, who chose quality over quantity, and lived their final decades with peace, energy, and clarity. So remember this: medicine is powerful, but you are the decision maker. Your body, your time, and your peace of mind are worth protecting. If this video opened your eyes to something new, please take a moment to like this video. It truly helps us reach more people your age who deserve this information. Tell me in the comments below, which of these 6 tests surprised you the most? Your answers help us choose what topics to cover next, based on what truly matters to you. And if you haven't already, subscribe to this channel and turn on notifications so you don't miss the next video, where we'll reveal the real warning signs your body gives before serious illness strikes. It's one you won't want to miss. Until then, take care of your mind, your body, and remember, aging wisely isn't about doing more. It's about doing what matters most. Thank you for watching, and I'll see you in the next video.